Hi, my name's Kelly Martin. I'm a Seattle firefighter paramedic, and I'm here today to show you our medic unit. This is what we look like when we're going on a response. I've got my partner with me today who's in the driver's seat. Her name's Marcy Grimsley. You can see that our lights are flashing for us, and also we usually have a siren, but we're not going to do that right now because it is very loud. If you follow me around here, this is my partner Marcy, who is wearing her full PPE. It stands for Personal Protective Equipment. It's to keep us safe. She's wearing a gown and gloves. She's got eyeglasses on and a mask to make sure she doesn't breathe in something that she doesn't want to be breathing in. You can come around with me now and we will look at the back of the medic unit. All right, so when I go in here, I usually make sure that I've got glasses on and goggles on, and when I'm seeing a patient, I'm dressed just like Marcy with all of my equipment on. This is our gurney. This is what we put a sick patient on. We're able to then transport them back here to the hospital. We then can take the gurney, pull it out, put the legs down, and we're able to take the patient on this gurney into the hospital where they can get definitive care from the doctors and nurses in the hospital. All right, once inside, we have a lot of equipment that we use. Thanks, you gonna pull it out of there? No? No, it's all right. We have a life pack that we can put on adults or children. We put some stickers on people, and it's able to tell us what their heart looks like, what the electrical activity in their heart is doing. We have our drug kit. And in this, we carry all sorts of important stuff. We carry stuff so that we can start an IV. We carry a bunch of different drugs to do different things for people. We've got other drugs here, a place where we dispose of our needles, and fluid that we can give people after we start an IV. We've got a blood pressure cuff to test their blood pressure. We've got a way to test their blood sugar. So we can tell a lot using the tools and the drugs that are in this kit. Our next kit is our vent kit. Also a lot of equipment in here. We keep a spare battery for our life pack. These are endotracheal intubation tubes. We use these to place in someone's trachea if we need to manage their airway. We've got some drugs that we use if we're gonna sedate someone to take over their airway. We've got an intubation kit so that if we do need to place that breathing tube right here, we can look in someone's mouth and see where it needs to go. Lots of interesting stuff in here. We've got some CPAP to help people, and a less definitive airway, a mask airway. And then back here we have what we call an Eshman and some different little tools and devices that we use. All right, and our last one, and these kits, these two kits and this go into every house that we go on. This is our pediatric kit. So if we're going to see a young person, this kit also goes with us. And it's got a lot of the same stuff that you just saw. It's got smaller needles and smaller blood tubes and that same intubation kit. All sorts of syringes and different devices that we can use. Sometimes we see young kids for a variety of reasons. We might see a child because they've fallen or gotten hurt, had some trauma. Another reason that we see a child might be because they've got a allergic reaction. Sometimes they get sick after eating something. So if we go, we have a different kit. Our BLS companies have what's called check and inject, and it's medicine that we can give a child or an adult if they've had an allergic reaction. We also are able to monitor someone's blood pressure. We take a cuff, put it around their arm. We're able to tell an adult or a child, we can tell what their blood pressure is. And we do a lot of this while we're driving to the hospital. So we slowly and safely drive the medic unit with the lights that you saw and our sirens to the hospital so we can get our patient that's on our gurney there as quickly as possible. That's about what we do as medics here in Seattle Fire Department.